Hypertrophic cardiomyopathy, HCM, treatment. Surgical options explained. Hypertrophic cardiomyopathy, HCM, is a genetic heart condition where the heart muscle thickens abnormally, potentially hindering blood flow. While medication often manages symptoms, surgery becomes essential when these measures fail. This article details the surgical approaches available, their benefits, risks, and who might be the best candidate for each. Understanding HCM and when surgery is needed. HCM affects the heart's ability to pump efficiently due to thickened muscle, particularly in the left ventricle. In obstructive HCM, this thickening directly blocks blood flow, leading to symptoms like shortness of breath, chest pain, dizziness, and even fainting. Surgery isn't a first-line treatment. Doctors consider it when medications are insufficient to alleviate severe, persistent symptoms. The decision requires careful evaluation by a cardiology team, weighing individual risks and potential gains. The gold standard. Septal myectomy. Septal myectomy is the most established surgical approach for obstructive HCM. It involves removing a portion of the thickened heart muscle that obstructs blood flow. How it works. The procedure is open heart surgery, meaning the chest is opened, and the patient is placed on a heart-lung machine, cardiopulmonary bypass. The surgeon precisely removes the obstructing muscle tissue. Recovery typically involves 5 days in the hospital, with full recovery taking 6 to 8 weeks. Why it's effective? By eliminating the obstruction, the heart pumps more efficiently, significantly reducing symptoms. Studies show patients who undergo myectomy have higher long-term survival rates than those who don't. Risks and AMP considerations. As with any open heart surgery, there are risks: fluid buildup, irregular heart rhythms, atrial fibrillation, and potential electrical system disruptions. Success rates are higher at specialized centers performing at least 10 myectomies annually. Younger, lower-risk patients generally benefit most. Heart transplantation. The last resort for patients with end-stage HCM heart failure unresponsive to other treatments. Heart transplantation is an option. However, it remains rare, accounting for only 3.5% of HCM cases. The process. This complex surgery replaces the failing heart with a donor organ. The patient undergoes extensive testing and evaluation before being added to a waiting list, which can vary significantly depending on organ availability. The surgery itself takes approximately 6 hours, followed by a 7-10-day hospital stay and months of full recovery. Why it works. A healthy donor heart eliminates the obstruction caused by HCM, improving long-term survival. Transplant recipients have similar survival rates to those undergoing transplants for other conditions, with around 75% living 5 years or more. Lifelong commitment. Heart transplant recipients require lifelong immunosuppressant medication to prevent organ rejection and diligent follow-up care to monitor the new heart. Other surgical interventions beyond myectomy and transplant. Additional procedures can address complications or secondary conditions linked to HCM. These include catheter ablation, corrects arrhythmias, irregular heartbeats. Coronary artery bypass grafting, CABG, restores blood flow in blocked coronary arteries. Heart valve repair replacement, addresses damaged heart valves. Maze procedure, treats atrial fibrillation. Implantable cardioverter defibrillators, ICDs. Preventing sudden cardiac death. ICDs don't directly treat HCM symptoms, but they are crucial for preventing sudden cardiac arrest. These implanted devices monitor heart rhythm and deliver an electrical shock if a life-threatening arrhythmia occurs. The bottom line, septal myectomy remains the gold standard for obstructive HCM, offering immediate symptom relief and improved long-term survival. Septal ablation, using alcohol injections to shrink thickened muscle, is a less invasive alternative. Heart transplantation is reserved for severe, end-stage cases. Regardless of the approach, expert medical guidance is essential for making the best decision.